and welcome to Developing Stories. Kunle Abiyo is my name. As prevalence of Lassa fever has become a major public health concern in some parts of Nigeria, particularly in Ondo State, medical experts are calling for heightened public awareness on the causes and necessary precautionary measures to curb the spread of the disease. Lassa fever is an acute viral illness which is commonly transmitted to human through contact with food or household items contaminated with urine or droppings from infected rats. And this special report, West House's Abidehi Akilotoye, takes a look at preventive measures residents can take to safeguard their well-being. The report is presented from our studios.
Lassa fever, a disease caused by Lassa virus, spread through contact with infected rats or the body fluids of infected individuals. Transmission occurs through direct contact with the blood, urine, feces, or other bodily fluids of an infected person, particularly in healthcare settings where infection control measures are inadequate. The disease has recently resurfaced in several parts of the country, including Ondo State. Medical expert Dr. Osrc provided valuable insight into the history and transmission of the virus. Dr. Osrc, alongside another medical practitioner, Michael Ayodele Ojo, explained the causes and effects of the Lassa virus, noting its severe impact when not detected early.
Lassa fever has been here with us, can say, since 1969. Let me give you a brief history of Lassa fever. Lassa was first discovered in a town called Lassa by an American missionary nurse in Borno State. The Lassa town is in Borno State. Lassa is a viral hemorrhagic fever, you understand, and that has been transmitted by multi-mammoth rats, rodents that you see around, rats, and of course, from Edo State, in Ondo State here, we have cases from Edo, Ondo, even Ekiti. But in Ondo State, especially in our Akure North, Akure South, this Lassa infection is quite on the high.
Lassa fever is a virus infection, and it's caused mainly by taking food which has been contaminated by the feces or urine of a particular rat. Okay, the rat lives, a kutele lives around. Okay, and if you open your food, okay, maybe gari or cassava or anything, and they piss into it, or they put their feces into it, and you eat, then you get this virus fever, which mainly allows you to bleed inside. Okay, your blood cells are killed, and then, of course, it's already difficult to take care of them.
Medical experts warn that delayed detection of Lassa fever increases the risk of death, emphasizing that early diagnosis and prompt treatment are critical to improving survival rates.
Majority of the time that you have fever, okay, which is not responding to the normal thing you are using, paracetamol, and then the person is getting weak. You should know this person is, possibly having Lassa, and you take the person to the appropriate place so that it can be diagnosed on time. The earlier, the better.
Practitioners also advise the public to maintain a clean environment, store food in sealed containers, cover dustbins properly, and block holes in walls or floors to prevent rats from entering homes. They further stress the importance of avoiding drying food in open spaces where rats could contaminate it, washing hands regularly, and practicing good hygiene to reduce the risk of infection.
We say prevention is better than cure. The emphasis is that you must ensure that you there's proper hygiene. You understand? You must cover your food or food items that you keep at home, because you can see that rat is our friend.
Health practitioners are calling on the government to take proactive steps in curbing the spread of Lassa fever. They advocate for localized health sensitization programs to educate healthcare workers within the state, rather than relying solely on international training in order to better equip them with the knowledge and skills to fight the virus effectively.
The government should provide necessary enablement to ensure that when patients are brought, they are quickly attended to.
To prevent Lassa fever infections, residents are urged to take precautionary measures such as avoiding contact with rats and staying away from areas that are infected. By following these safety precautions, the risk of contracting Lassa fever can be significantly reduced.
Meanwhile, the Nigerian Center for Disease Control and Prevention has listed 315 persons for follow-up over the possibility of being infected with Lassa fever. This follows the death of a 31-year-old physician who returned from the United Kingdom on February 27, 2025 and died of Lassa fever on March 1, 2025. The physician was said to have been managed at a private health facility in Ondo State after returning from a trip abroad. Data obtained from the NCDC show that 535 persons have been infected with the disease out of the 2,728 suspected cases across 13 states and 75 local government areas. It also noted that 17 healthcare workers have been infected with the disease in Ondo, Boshi, Edo, Taraba, and Gombe. The NCDC added that the National Lassa fever multi-partner multi-sectoral incident management system has activated to coordinate the response activities at all levels. No fewer than 32 individuals have been convicted of internet fraud by various courts in Ibadan, the Oyo State capital. The convicts were prosecuted by the Economic and Media Crimes Commission (EFCC) Ibadan Zonal Directorate of a separate one-count charge bordering on impersonation and cyber-related offences. The Federal High Court sentenced the fraudsters to very jail terms and community service. This was disclosed in a statement by the EFCC's head of media and publicity, Dele Udiwale. According to the EFCC, the convicts pleaded guilty to their respective charges and they were sentenced accordingly. The EFCC reiterated its commitment to clamping down on internet fraud and other financial crimes across the country. At least 4 persons, including an auto technician named Rotimi Adeleye, have lost their lives and over 16 vehicles burnt